While that's warming up, let's have prayer together, shall we? Our dear Heavenly Father, we're very thankful that we can come to you, and we are very aware of that with your loving heart and sending your Son to us to die for us, that we might have eternal life, and the Holy Spirit wanting to work upon our hearts, that it's a very sad thing for all of heaven to witness all the deaths that are happening here on this earth because of this disease. And so help us to be able to understand and to be able to help others, and then as this video might go out to the others, that people will be able to understand about their disease even in their homes, and they might be able to not have a heart attack. We thank you in your holy name, amen. Now, does this always make this amount of noise? It's that loud? Okay, good. Now, all of you by now know about New Start: nutrition, exercise, water, sunlight, temperance, air, rest, and trusting in God. So what's your secret for staying so young? And don't tell me it's diet and exercise. I tried that stuff for almost an hour and it didn't work. We're funny, aren't we? Okay, blood pressure. What is the high blood pressure? Well, they're having different ideas about this now, because 180 over 100 obviously is a high blood pressure, and you have 3 times the added risk of heart disease with a blood pressure like that. All through the years we've said that 120 over 80 is a normal blood pressure, but the diabetics, they want the diabetics to get their blood pressure lower than that. Now that's pretty tough, because a lot of diabetics can't get their blood pressure even into the normal range. Now what about 100 over 70? That's a lower risk. How about 90 over 60? That's even a lower risk than that.
Well, why do they say that they want to get a diabetics BP down to 150?
Okay, well, we'll see that, because the higher pressure pushes the cholesterol into the artery walls. And we'll see that in a subsequent slide.
If you don't have cholesterol problems.
Okay, so the thing is now, though, they decided that what they wanted to do to stop all these strokes that they were getting with people that had high blood pressure, they said, let's get the blood pressure down to 115 over 75 instead of 140 over 85. Let's bring it down like that, and let's do whatever we have to do in order to get the blood pressures down. Now that seems like it'd be a good idea, doesn't it?
Yes.
Because what they're trying to do is stroke but lo and behold, when they did the analysis of what was happening, they found out that they had 2 times the number of heart attacks for every stroke that they prevented. Not a good statistic. And so there's got to be a better way than to try to bring the blood pressure down. So they said, well, yeah, we'll be satisfied if the blood pressure now, after this study, if the blood pressure is 135 or less, over 80 or less, then we're going to go with that, because it doesn't seem to increase the number of heart attacks when that. Why do you think that might be? if you get the blood pressure low enough, the heart is not getting enough oxygenated blood. Does that make sense? So they preserve the brain and the heart stops. So that wasn't a very good thing. And that study has only come out in the last year. But it's surprising when we do analysis and find out and see what we're doing. Did it really make a big difference? Okay. This is something that's very, very important. And this is really the take-home message that I want you to know, as well as the exercise message. And this is what's happening. This is a very, very small blood vessel. It can't be seen with the naked eye. It's the diameter of 3 red blood cells. Now here's another one. And this is the diameter of 4 red blood cells. What makes a difference in these two? It's your diet. And we'll see this as we see the slides as we go along. This one is very high blood pressure. And this is a person that's eating animal fats. This is the one that's only eating plant fats. What is the difference? How do we know about this? Well, prostaglandins. Is what makes the difference. If a person is eating animal fats, the blood vessels are constricted, the tiny, tiny little ones, before it goes into the capillaries. After the capillaries, it's going to go into the veins. But as a person starts eating just the plant-based foods, they get a relaxing of that artery, and you get a dilation of those little blood vessels. What does this do? This is called Bernoulli's law. That won't be on the test. But it's the radius of this diameter squared. That's not a big deal. You don't really have to know the math on that. But what happens is that there's an increase of 75% more oxygen to the tissue when this happens. Now, we've talked about this before, and as we go along, you'll see what that means. If you get 75% more oxygenated blood to your heart, within 3 days, your heart starts pumping more efficiently. When your heart is able to pump at a higher pressure, it puts more blood through your kidneys. And that helps to filter out the impurities in your blood. And it also gives you more circulation to your brain. And that's a big deal in Alzheimer's disease. Tuesday, for Fresh Start, we're going to talk about Alzheimer's disease. I have the lecture at the 7:45 lecture. Okay, the large vessels, we're not talking about those. If you see the large vessels like the aorta, and you look in there, instead of having that nice red Teflon-like coating in there, it looks like scrambled eggs. It starts down here in your legs, and it goes all the way up past your kidneys, and maybe into your kidneys, into your heart, up your neck, and then into your brain. And this is the progression. Now we're talking about the tiny vessels, and that's like a plugged up filter. Now what you need to do is you need to understand this concept. If you have a plugged up filter in a tube, say, what's going to happen to the flow beyond the plugged up filter? What happens to the flow when this filter is plugged up? What happens to the flow? It's going to be decreased. Okay, since the body can't allow that to happen, what's going to happen to the pressure so that they can at least get enough flow to keep those tissues from dying? So the pressure is going to go up. Just intuitively, you know that. Okay, so the pressure's up and the flow is decreased. Now you open those up, and your whole body is completely filled with these tiny little blood vessels. And so now the flow goes in there, and your whole body now is getting 75% more oxygen to the tissues. And the heart is getting strong. Usually by the 8th to the 12th day, people that have had anginal pain will be able to walk very slowly around our half-mile loop without the pain. Or if the pain starts coming, they can just slow down and keep on walking. It's truly amazing. 3 people without any change in their medication have lost 30 pounds of water because their heart was strong enough to pump it out through the kidneys. That's truly amazing. I've never heard of that. I've never seen it anywhere. It's not in print as far as I know. But we see that in people that go on that kind of a diet. Okay, the capillaries, after you've eaten a fatty meal, the red blood cells are sticking in there together and they're going through slowly. And that's probably the reason why people have problems after a fatty meal. And like I said, between 4 and 6 o'clock in the morning is when a lot of those heart attacks take place. Okay, I didn't know this. It was never told to us in medical school, and I didn't read about it anywhere, but it is in the literature. If you want to find out prostaglandins and see what they do, you can Google it, but it'll take you a while to read through. Probably in about 30 minutes you'll come to something that talks about the prostaglandins, the right kind, will protect your kidneys. But there's 3 3/4 million hits on prostaglandins, so there's a lot of information there. Now the standard American diet is what's responsible for what we have. Like I said, when I was in Africa, I was there 15 years, and I only saw 2 people with a heart attack. And both of those people were at desk jobs, and they were eating a Western diet. Okay, this is the Nutrition Action. And if you want to get that newsletter, it's the Center for Science and the Public Interest. I think it's out of Washington, D.C. It said, "What if fat doesn't make you fat? The truth about the Atkins diet." Now, I've referred to this before, but this is a normal perfusion, and the redder it is, the more oxygenated blood is going to that part. This is the strong part of the heart where most of the muscle is, and you can see it looks pretty good. This side over here doesn't have to have as much oxygen flow to it because it's not working against such a high pressure. Now, the cardiologist back east that I saw in the Today Show did this, and he found that these people all, he followed 11, he found these people all had normal perfusion to their heart. This is right at the cellular level. At the end of the 1 year, they followed them, and they were sure that they stayed on the Atkins diet. This is what the heart looked like. Okay, this purple here, this part here really needs to be there's a lot of muscle on this side. It needs to be strong to push the blood all the way down to your toes and then back again. It comes back. By the way, that's very, very fast. How long does it take to go from your heart to your toes and back to your heart again? 7 seconds. So it's like it's compression on your heart. It's down there, it goes to the capillaries, and then it comes back in a very low pressure. The low pressure doesn't push it into the walls of the blood vessel. And so this is what he found, and he showed this to the people that were watching the Today Show. I think it was about 15 years ago. I was just very fortunate to have seen that. Now, Dr. Atkins came on and basically called this cardiologist a liar. I don't know how you can lie on a test like that. And so the handout that I gave you, you have it there, the controversy over Dr. Atkins' death. And you have that, and you'll see that actually before he died, I heard him on the radio, and he said that he got a large flabby heart from a virus infection. Now, a viral infection, we call it cardiomyopathy or cardiomegaly, and a virus can do that. Another thing that can do it is a person that's an alcoholic. They can have that. But also the cardiologist, before his happened, the cardiologist told him what was happening to a person's heart if they did that kind of a diet. So he had this large flabby heart. A heart's supposed to go a strong beat, and it goes lup, dup as the valves are closing. And the large flabby heart is leaking. The valves are not competent, and it kind of goes like I had one lady that used to go in every 2 weeks to the emergency room, and she was in her 70s, and they would put her on an IV drip and take 15 to 17 pounds of water off of her just so that she could make it through the next couple of weeks. After she left here, I followed up, and she said that she never had to go back to the emergency room. This was six months later. So how does this work? Well, as soon as your heart gets oxygenated blood and the cells get healthy, then that's what happens. And so I want to encourage people to realize that this is what we want to do, is we want the heart to get that circulation again and to get healthy again. Now, are we talking about these large blood vessels that are plugged up? Are we talking about all those plugs start coming away in 3 days? No. It's what's beyond those plugs that are getting the oxygenated blood. A short little thing that they can stent, that doesn't really change the pressure. When the atherosclerosis goes all the way along the artery, then that's the problem. Okay, so there's the fat in the diet. The double Whopper with cheese, almost 1,000 calories with 61 grams of fat. Stan's Snack Shack. The man says, is it really cholesterol free, this foot-long hot dog with all the mayo and all the trimmings? And the fry cook says, the cholesterol is free. We're not charging you for the cholesterol. Okay, now here's the answer to that question. The fat that's in the diet, especially people with diabetes, they have more fat in their circulating. Remember, the high triglycerides, the high cholesterol, which comes from the low HDL. Smoking and high blood pressure are responsible for helping the fat go out through these little tiny, you see these cells here? These cells here are the lining of the cell, of the artery. And while those are there, things don't stick. But as the pressure goes up and more goes outside in this lining here, then we're going to finally get it where those cells just come loose, and we call that a fatty streak. That's the first indication that disease is there. And now what happens? The platelets stick, the cholesterol is there, the flow isn't good, and there's going to be a clot. Who gets these fatty streaks? Our 3 to 8 year olds already start having the fatty streaks. Who gets the 45 to 65% blockage of their coronary arteries? Our 18 to 24 year olds. How do we know that? Because people that are killed in the armed conflicts that we have, when they do autopsies on them, that's what they find. Okay? Now here's the next one. Here we're not seeing a cross-section of the artery, but we're seeing this here. And what they've done is they've taken a little section right here, and this is those cells that I was telling you about. Remember the Teflon coating? Okay, this is the cholesterol that's floating through the blood, and when it's under pressure or the person's smoking, it's going to go out through these. Can you see how the pressure would force it out through those openings? And when you smoke, it opens those up and lets more cholesterol go out there. Now what's happened, that can be very, very toxic to this blood vessel and to these cells here. So these, you saw them as monocytes. These are the macrophages, and here's another one that's coming out there to give help. And these cells here have gone out there, and these are filled with little cholesterol particles. Why do they do that? To protect these cells so that they've still got something to hang on to. Now this is a very interesting thing. This cell right here, it's like if I went over to the door here and I pushed my foot underneath the door, and then I sent all my body into my foot, I would come up on the other side of the door. Very, very interesting, isn't it? That's what's happening to this cell. It doesn't have any cholesterol in it, but it's going out there to help these guys. But after a while, it gets to the place where they can't keep up. And then those cells will all come off and you'll get the fatty streaks. Now the question is, can this be reversed? Well, from Dr. Esselstyn's study, you see that it can. Now I'll refer to this again now. But in 1985 to 95, Dr. Esselstyn had 22 patients. 17 of them stayed on the program, and they were cardiac cripples. And you can see this from your handout, but now this is almost 30 years later, 25 plus years later. These people, some of them had had as many as 4 coronary events. These people are all still alive, these 17. That's really remarkable. They said, Dr. Esselstyn, that's too small of a group. So now just this year, in the Journal of Family Practice, he has 177 that he's followed, and only one, he wanted to get 200, he got 198. Some of them dropped out. But he followed, and the ones that, the 177 that stayed on the program, only one had a coronary event, didn't die, but had a coronary event. And so that means that in 3 to 4 years, all 177 are still alive, and 176 have had no more heart attacks or coronary events. That's really, really remarkable. So do this. That's Esselstyn that has the totally plant-based diet, eating the plant-based diet whole. Okay, so now let's go on. Now, the thing is that people, especially that are not having anginal pain, they say, well, I'm sure I don't have any heart disease because I don't have any pain. Okay, lifelong smokers have a 1 in 2 chances of dying from smoke-related disease. And the smoker is saying, that'll never happen to me. The odds of winning the Powerball lottery are 80 million to 1. Hey, this could be my lucky day. Okay, here's an artery, and it's plugged up. And you can see there's a lot of plug in this artery. What's happened is it's broken open, and the plaque has come out. Now, that's very vasoconstrictive, and so the platelets rush in, the fibrin rushes in, and the red blood cells are caught, and now we have a clot there. What's going on downstream, remember, if you've been exercising, other blood vessels have come in. If you haven't, it will probably be a fatal heart attack because all the ones that artery was supplying are not going to have any oxygenated blood. Okay, now here's the better picture as far as I'm concerned. And here's the point that I'm trying to make here on this, and you'll see the next slide. It's the most startling fact. Here we have the artery. This is perfectly clear. Starting to get a little plaque. Right here you see this. That's in the wall of the artery. Going on, right here in this section, more severe plaque. And then right here, this is where it's really, really almost occluded. 85, maybe 95% occluded. But as long as see, you can't see this very well, but this is an organized plaque. And this is not going to break open. What is going to break open? Now this is a very, very important point. This is the point of what I'm trying to show you now, is that it's not here where it breaks. It's this new hot inflammatory plaque down here that's only about 40 to 60%. It's new plaque, it's hot, and it's ready to break open. And this is what they're showing here. This plaque broke open, and it sent this down, and then it can cause a spasm here, and then there will be a clot. Is there any question on this? Because you've got to get this concept. Do you understand what I'm saying? Not the old plaque that's been there, but the hot new plaque is the reason. Okay, this is the startling fact. 70% of all heart attacks happen in arteries that are less than 50% narrowed at the time the heart attack begins. Did you catch that? So if the doctor says, well, you've got 3 places here, we can stent those. Where is a heart attack going to happen? 70% of the time, the heart attack is going to happen in those hot plaque. It's only 50% or less than 50%. Do you get the implication of that? Most people do not know that. They might get a squirt that goes into their coronary arteries, and they'll say, you know, you only have about 45 to 75. No, you may only have 45 to 65%, and we find that in our teenagers. That's not a problem. It's not those really tight plaques that are blocking off there. That's not it. So you've got that idea now. It's those hot plaques that are breaking open. And so that's the last part of the story. That's the bottom line. So eating the Genesis diet, the Eden diet, God saw everything that He had made, and it was very good. Today we would translate the Aramaic into God saw everything that He made, and behold, it was perfect. That's a hard concept, because we as humans can always make something better. At least we can try. Okay, Now this is what we're talking about here. When we eat the plant-based foods, we have 18 carbon fatty acids. When we eat the animal foods, we have 20 carbon fatty acids. These are the prostaglandins 1, and this is the prostaglandin 2. You can say, well, there's only 2 carbons difference. What difference could that make amongst a group of friends? But it makes a big difference, and you'll see that in the next slide. This is where the 20 carbon arachidonic acid, and this is where the fish 20 carbon eicosapentaenoic acid. Okay, this is the prostaglandin sub 2. This is prostaglandin sub 3. This is prostaglandin 1. These are the ones that will not give you that vasoconstriction and will give you 75% more oxygenated blood and will start your heart on the road to recovery. Even before those arteries are starting to clear out. It takes about 3 to 4 years for a lot of that plaque to clear out, and that also will drop your blood pressure. And now they know about the prostaglandins on this side. So these that come from the plants, good. These that come from the animal fats, those are the ones that cause problems. Now here we go. Here is the one, it's a red blood cell. It's 8 microns. And this one's a diameter of 4 of the red blood cells. This one's a diameter of about 3 of the blood cells. Notice the difference here. 194 over 113. Over here, 138 over 73. This, even now, even within the last year, they would say, this is the better blood pressure than driving it down like we tried to do before with the medications. So does everybody have that in their mind? Because that's very important.
Doctor, was that just for diabetics or for everyone?
Anyone. Anyone that's eating that kind of a diet. Okay, now, here's the next thing. If there's something that dilates it, and you get that flow and the drop in blood pressure, and a lot of people get that, you'll see in the subsequent slides, there must be something that'll bring it back the other way. Something that'll constrict this and make it go to this. What is that? That is adrenaline. Shall I write it here? And everybody knows what adrenaline is. People think that it's just for fight and flight. You see a bear come through the door here and gives a big roar. All of us will go right out that door at the same time. We'll look around and we say, how did you get here? But this is very important that these blood vessels can go back to this for certain reasons. What is it? Because if you can't have that little bit of adrenaline going there all the time, you wouldn't be able to sit up. Now when you decide to stand up, more adrenaline will come in. If you decide to walk, and then if you decide to run, you'll have more and more adrenaline. And what's going to happen is that these blood vessels that were all dilated here, they're going to constrict like this, and then the blood is going to go out of those places, and it's going to go into your muscles, so that you can run. Is that something that you can understand? Okay, and so we need to have them be able to constrict again when we need them constricted. But most of the time we're resting, and we want the flow to go to all those organs. Now, eating the plant-based and dilating like this so that it's like an opened up filter in the blood flow. Some of the people get off 3 to 5 different types of blood pressure medicines in 1 week. We had one person come in, he was on 7 different blood pressure medications. There's only 5 classes, but they gave him 2 of some of the classes that were a little bit different. He was in a wheelchair on oxygen. And by the we took him off of the medications because he couldn't stand up. And by the end of the program, he was out of the wheelchair, off of his blood pressure medications, and he was able to walk around the half-mile loop. It's really very, it works very quick. So now, this one, I'll have to go through this rather quickly. But diuretics are the ones that we gave. Remember that long word, hydrochlorothiazide? And I've said this before. This was for all of our seniors when their blood pressure went up. We gave them 50 milligrams. And if they needed more, we gave them 100 milligrams. And if we gave them more, we gave them 150 milligrams. Sometimes. And Dr. Jeremiah Stamler out of Chicago started looking at this, and he said, hey, what I'm finding is that the people that were using that much hydrochlorothiazide, they're dying faster than the people that aren't even taking their medicines. There's something wrong here. So now you won't see a doctor, hopefully, giving more than 25. In fact, they've cut that in half, and you'll find some of the doses are only 12.5. They can help out. What do the beta blockers do? This adrenaline thing, you see. Beta blockers will make the heart beat faster and will make it beat stronger. I mean, the heart, when it needs to, is going to beat faster and stronger to raise the blood pressure. The beta blockers will block the adrenaline so it can't do that. A lot of people feel very weak when they're on a beta blocker. The calcium channel blockers, they do the same thing. The heart can't pump as strong. It lowers the blood pressure. But is that what needs to happen when the organs aren't getting the blood flow that they need? That's not a good idea. Okay? And then the ACE inhibitors, we've got another one called the ARBs. Now, the kidneys will send a message up to the heart. Get us more pressure down here. We're suffering. We need more oxygenated blood. But that angiotensin enzyme inhibitor keeps that message from going from the kidney to the heart. Now in the last 15, 20 years, we found out that the heart has a way of regulating itself if it doesn't have enough oxygenated blood, and it can push the pressure up. So now, I want to do this very quickly, but it's important. If you had a hose pipe there, a hose that was on the on your outside wall, you turned the water on, and you were watering your petunias, but there wasn't enough pressure. What would you instinctively do? You put your thumb over it, and then you could squirt further down. But what if you still couldn't get the ones that are over on that wall? Instinctively, you would go over and you would make sure that the tap was on full, and now you could go over here and you could squirt clear down to there. What do the diuretics do? I know we need them when you're in congestive failure and so forth, and your heart can't keep up. But what do the diuretics do? They keep the volume low. That does not help the flow to the end organs. The beta blockers, if the heart needs to beat stronger and faster, and we don't let it do that, that doesn't help the flow to the tissues. The calcium channel blockers doing about the same thing. The ACE inhibitors. So what we need to do is we need to be able to dilate these and get 75% more oxygenated blood to the tissues. I've said that 3 times now, and I hope that everybody understands that. How about that? Does this work? Well, we had people come in. This was when it was a 4-week program, and the people were able to get down. This was their This was their amount of medications or the drugs that they had to take. At the end of 8 years, their blood pressures had gone up some. I don't think that the 73 had been totally on the program. I doubt that they were. But still, they hadn't had to take the same amount of blood pressure medications that they had before. And this was 6 months to 8 years follow-up. Okay, so if the pressure is lower, remember we talked about the lower blood pressure without opening up those tiny blood vessels? Wouldn't that cause damage to the tissue? No, it's just the opposite. Because the blood flow is increased and the pressure is dropped. And that's from the prostaglandins that are from the plant sources. So there's the brain, the heart, the kidneys. Those we see effects in those right away. Now here's a difficult diagnosis. The doctor is saying, you're retaining ice cream is the problem. Okay, here was George Allen. He was taking nitrous all the time because he had so much anginal pain. He also had a lot of emphysema. He was sitting at the back and you could hear him breathing like that because of the secretion, the broncho problems that he had. By the second week, because he wasn't making as many secretions and he was breathing easier, the angina was almost gone and he was walking 4 miles a day with no pain. We took him off of 11 of his 14 medications. This was my father. He had fallen and crushed his chest. He coded 3 times in the intensive care unit. He was in and out of ICU for a month, and then Medicare said that he was well. He had to go to he couldn't stay in the hospital anymore. So he was going to go to a skilled nursing facility. Instead, we brought him up here, and I put him on a very accurate scale. And the 6th day that I checked his weight, he had lost 17 pounds of water out of his legs and his lungs. We had taken him off of 9 of the 10 medications. We had to add a little bit of the beta blocker back to slow his heart down, but he was on only 1/6 the amount of medications. I saw him, he was looking at his ankles, and I said, Dad, what are you looking at? He had had high blood pressure for about 30 years. He was a pathologist, and he took this medication and that medication as he thought he needed to or wanted to. That can get you into trouble. But anyway, I said, but he did walk. He walked between 3 and 5 miles almost every day for all those years. So he had a lot of collateral circulation. He was just 2 weeks shy of 91 years old when he finally did die. But he was looking at his ankles, and I said, Dad, what are you looking at? He said, I don't have any swelling in my legs and my ankles now. This was on day 6. I said, Dad, how long has it been since you haven't noticed any swelling? He said, I don't know, probably 25 years. Day 6. Praise God, from whom all blessings flow, right? Now we'll be talking about Alzheimer's disease. The reperfusion, there's a halo effect, and we'll have to talk about that when we talk about the Alzheimer's disease. But hyperbaric oxygen can help the sick brain tissue that hasn't died but is not getting good circulation. But when we have the tiny blood vessels dilating up, this happens 24 hours a day, and we see the same kind of results. People that are post-stroke and so forth. Dr. Wilson was here. He had a massive brain stem stroke, and he was told he'd never walk again, but he came here and we got him out of the wheelchair. He stayed here. He was living alone, and he didn't trust himself, so he stayed here for 3 years, and each time he reached another milestone, the Auburn Journal came out and did another interview on him. Finally, he had walked 7,000 miles, and at one stage, he showed me that he could actually break into a jog. And this is the nun study, the Catholic sisters, and we'll talk about that. It says, believe it or not, this 91-year-old nun can help you beat Alzheimer's disease. A landmark study of the disease sheds new light on what causes it and how to prevent it. And this is what should do it. I've seen some good results. Dr. Michael Jacobson, he's in that Nutrition Action Center for Science in the Public Interest. Prevention of Alzheimer's disease. If the same diet that prevents heart disease and stroke also prevents dementia, we've got one more reason to eat those veggies, and you sure do. Okay, what about the kidneys? I won't go into this, but remember we talked about the lower protein? So there wasn't so much problem. And then when the person has that and their heart starts pumping better, this lady, Gloria Wilson, African American, she came up in an RV. She was too sick to sit up. When he checked her blood, a normal blood urea nitrogen, we talked about that when we talked about the protein. Hers was 98. Usually she would have a shunt put in her arm or get prepared for dialysis. I said, Gloria, why didn't they give you dialysis? She said, my heart was so weak, they said that I wouldn't be able to take it. Now, she was able to not have any dialysis, and her blood levels came down to normal. Now, after a period of about 5 or 6 years, she was found to have cancer of the breast, and unfortunately, she hadn't stayed on the program, but it probably would have prevented that. But anyway, she had the surgery, and then she got a post-op infection. They had to put her on a really strong antibiotic, and then she went on peritoneal dialysis. But she didn't have to have any dialysis for 7 years. Now the adrenaline, here we go. Not only for fight or flight, but it directs the blood flow to the muscles, and it's necessary for standing, walking, and running. If you couldn't react to those, we would have to bring in a wheelchair, and you'd be sitting in your chair like this, and we'd have to lift you into the wheelchair and take you and tuck you in bed, because you wouldn't be able to stand up if you didn't have any adrenaline to make all those things happen. Okay, this is the nerve impulse that comes down from the brain, and these are the adrenaline packets. That signal comes down at 130 meters a second, so it's instantaneous. It releases those adrenaline granules there, and you're going to get constriction in the blood vessels that need to be constricted, and then you're going to get more flow in the other ones to your muscles and so forth, so that you can move. Okay, now what about the flow of adrenaline and there's no muscle activity? What's going to happen there? It's going to be a stress hormone. So if you're sitting there and you're stewing about something, and all these blood vessels are all constricted and everything, and there's no flow going into your muscles, what's going to happen? It's just going to raise your blood pressure. And as that happens again and again and again, eventually your blood pressure is going to be reset at a higher level. Now here's something that my wife found just on the internet last week, that walking affects those pressure receptors, and as you're walking, that will reset your heart so that it can lower the blood pressure. That must be another reason. I don't think that Dr. Evans knew about that, because that's something that's new. Now, admittedly, that's in a mouse model, but it probably happens in us as well. So stay tuned to that. Now, what about stress? If a person has no stress, they say, I'm going to retire and I'm just going to fish, or whatever. That's going to be stressful eventually. So here there's work pressure. Okay, and then job performance there. So work under load is going to be very stressful. Inadequate workload is still going to be stressful. And then you're going to have the optimal work pressure. Then going on the other side, added work pressure, and then work overload. This is something to realize about stress. So don't try to alleviate all stress in your life, or you're thinking, oh, I'm getting stressed now, and it's more stressful. Go for a walk. Walk and walk and walk. Take your cell phone with you. Walk down Giesendorfer here, and when you get to Auburn, give us a call, okay? We'll come and get you. By the time you reach there, you will have forgotten what it was that was giving you a problem. Okay, job strain increases the risk of coronary events. This is neuropsychiatry reviews. Sorensen, get in here and squirm. Here's your job stress. Before I tell you what you owe, try our complimentary nitro patch. Get those coronaries dilated before you have the shock. This is another one. Sometimes there's actually marital stress. Apparently I've done something to upset you. Okay, so when the adrenaline is there, we've got to burn it up. Get up, walk. So a sense of well-being from the physical activity, weight loss and appetite control, and longevity especially. Ways to avoid exercise. My doctor told me to run 5 miles every day before breakfast. The only thing that I could do was give up having breakfast. Okay, this is the take-home message, and it's on your sheet there. Dr. William Evans, he was at Penn State University. He's at a different university now, but with hypertension and exercise, a person is expected to live longer than someone who has normal blood pressure and who has no regular exercise program. It's really very powerful. Okay, exercise, there's no current medicine in use or anticipated in the future which will be as beneficial as exercise. As I told you before, exercise is 2/3 of your program. Now they're finding out about your chromosome ends, the telomeres. Now they're saying that it's even more. Exercise is the only one that can keep those telomeres younger. And so it's more than 2/3 of your program is exercise to stay healthy. Here's someone here from the President's Council on Physical Fitness, Herb. He has a warrant. Okay, now remember this when we talked about the metabolic syndrome. What was one of those little circles there? One of those little circles was talking about that the ACE inhibitor blocks that. It's angiotensin 1 going to 2. You don't have to know all that. But when a person is like this fat will block that. Those little circles that were there, it showed that it leads to hypertension. The fat inside the abdomen sends a signal to your body, and that increases your blood pressure. And when that fat goes out and you go over to here, that signal is not going anymore, and the blood pressure will drop. And that's another reason why to lose weight helps you with your high blood pressure. So adrenaline, prostaglandins, eat the right foods. Just so you'd know, I never want to live in a vegetative state depending on some machine. If that ever happens, just unplug me. Okay? Okay. Hey! Okay, what time I am afraid I will trust in thee. This is the clot buster, trusting in God. Now I know that success stories is a very important thing, and this is an add-on. I actually went to school with this guy. We were we were down in Loma Linda at the elementary school, and when he came up and he said, "Don't you remember me?" Well, I think the last time I saw him, he was in 6th grade. And I said, "No." He said, "Well, I'm Tommy Miller." "Oh, okay." So you've been very successful. He's a dentist in Hawaii, and he was really, he was on his way to a massive coronary. You can see all the things. 381 pounds. And so here he was, 240 pounds, normal blood pressure, and the blood sugar no longer on any medications. So normal blood sugar, normal blood pressure. He lost 141 pounds. Now the interesting thing is that some of his patients hadn't seen him. They were coming in for their yearly, and they said, no, I really like Dr. Miller and I want him for my dentist. And he said, "Well, I am Dr. Miller." So that was a change.
How long did it take him to switch that?
I think that it was 6 months to a year, but I mean, he kept doing that. Thank you, folks. It was a long, but anyway, it was, blood pressure is a very involved thing, and there's a lot of things that happen